there are any remaining questions when we conclude and you feel your question hasn't already been answered, please submit your questions in the chat or by email, and we will work to get you a response in writing. We will begin in just a few moments after we grant the recording permissions.
Hi, everybody. Brian Duffy in the 19 News digital studios. We are just moments away from a press conference in Columbus with the Ohio Department of Health. We are expected to hear from two doctors on two significant issues that we are dealing with in Ohio. Number one is whooping cough, believe it or not. We've got a significant amount of whooping cough in the state of Ohio. Overall this year through November 4th, Ohio has reported 603 cases of whooping cough. That's a 415% increase over the Buckeye State's 117 cases over the same time period last year. Let's listen in. Here is Dr. Bruce Vanderhoff.
The holiday season is upon us already. It's a wonderful time of year in so many ways. But as I've shared before, a season when Ohio and the nation typically see an increase in respiratory viruses. At this point last year, you probably recall, we were in the midst of a dramatic spike in both influenza and RSV cases. Now, I'm happy to report that is not yet the case this year. Flu cases remain minimal in Ohio, although we are seeing a slight increase in several southeastern states. Likewise, we are starting to see a small increase in RSV cases in Ohio, but like with the flu, this is nothing like we saw this time last year. Now, regarding COVID-19, the slight surge we experienced late in the summer seems to have receded, although there have been ups and downs week to week. This is good news. But at the same time, history tells us that we will almost certainly see some sort of winter surge in COVID-19, RSV, and influenza. That underlines the importance of taking advantage of this current window of opportunity to get vaccinated against these diseases. For RSV, it is especially important if you have a newborn, age 8 months or younger, and mom did not receive a vaccine during pregnancy. If this is your situation, I encourage you to contact your provider and get your child an RSV shot now. While influenza for most of us does not lead to hospitalization or severe illness, it does for some, and especially for seniors, it can be a very serious illness. Again, the flu shot is readily available. A surge in flu cases is almost certainly inevitable. And this is the perfect time to get the protection you need from a flu shot. And of course, we have the updated COVID vaccine that in September was approved and recommended for anyone 6 months of age or older. So far, more than 882,000 Ohioans have received this vaccine, or about 7.6% of the population. The vaccine is particularly important, as I've mentioned before, for those age 65 and older or who are immunocompromised. About 24% of Ohioans 65 and older have received the new vaccine. Speaking of the updated COVID vaccine, beginning today, the department's COVID vaccine dashboard will focus on the updated vaccine. This makes sense, as the new vaccine replaces all previous versions of the vaccine. Now, we'll continue to update this dashboard on Thursdays, and the previous dashboard will be archived and, of course, will remain available. Well, I want to talk turkey now, or to be more specific, I want to talk about how much turkey and other Thanksgiving favorites you and I should eat on Thanksgiving Day, which is a week away. Like most of us, I enjoy this holiday, and we all should. It's a wonderful time of gathering with family and friends and for being thankful for what we have. But I'm also mindful that the Ohio Department of Health's mission statement is to advance the health and well-being of all Ohioans. And the honest truth is that too many of us are struggling with obesity and excess weight. And that can have very serious adverse effects on our overall health. According to the Centers for Disease Control and Prevention, in 2022, 38.1% of Ohioans had obesity, which is defined as a body mass index over 30. The national average is 33%. Sadly, this ranks our state 7th in the nation in adult obesity prevalence. It's a national problem for sure. The CDC noted in 2022 that 22 states had an adult obesity prevalence at or above 35%. For perspective, a decade ago, no states had a prevalence that high. The problem is that people with obesity are at a greater risk for chronic diseases, including diabetes, heart disease, stroke, and some types of cancer. Obesity also is associated with poorer mental health outcomes and a reduced quality of life. If you have ever had a discussion with your healthcare provider about the need to lose weight, the prescription for how to do so has some key elements you've undoubtedly heard before, and these include eating better and exercising more. The CDC reports that only 4 in 10 children and fewer than 1 in 7 adults eat enough fruit. Fewer than 1 in 10 children and adults eat the recommended daily amount of vegetables. And only about 1 in 4 adults fully meet the federal physical activity recommendations. The CDC estimates that obesity costs the nation $173 billion annually in increased healthcare costs. America clearly has a weight problem. And Ohio, in so many ways, is reflective of the nation as a whole. We too have a problem. So the question becomes, what are we going to do about it? Governor DeWine has made it a high priority to point us toward a future in which Ohioans can live their healthiest, best lives. That's not only good for us as individuals, it's good for the state's reputation, for the business climate, for employment, and so forth. As a health department, we are rolling up our sleeves and getting to work with some important investments in this arena. Our Creating Healthy Communities program currently has funded grants in 22 counties in Ohio. The focus is on promoting healthy eating and active living. This can take on many different forms, from supporting the creation of community gardens or farmers markets to renovating an obsolete playground or building new sidewalks and bike trails. In addition to the 22 counties where we have active contracts, we also are working with 17 additional counties to help them prepare to successfully apply for a Creating Healthy Communities grant in the future. We recently awarded a nearly $900,000 state physical activity and nutrition, or SPAN, grant. We were rewarded by the CDC. This is the second 5-year grant Ohio was awarded, following up one in 2017. A major emphasis of this program is to expand produce prescriptions. This is exactly what it sounds like, a prescription for produce written by your healthcare provider who likely has identified a health condition such as diabetes or hypertension that is responsive to your nutrition. The Ohio Department of Health then attaches funds so that people can buy fresh produce at a farmer's market or a retail store. We contract with an organization called Produce Perks Midwest to run this program, which also includes providing educational program through the course of that treatment plan to help people better understand the concept of healthy eating. Several years ago, we piloted a produce prescription program in Athens and Logan through federally qualified health centers. A cohort of patients with diabetes was identified, and through the course of the 6-month program, we saw that participants reduced their A1C levels, a marker for diabetes, in their blood. Another initiative supported by the SPAN grant is workplace nutrition, where we work with employers to improve their food choices on the work site, whether that be through vending machines or the cafeteria or both. We understand that it can be easy for a medical professional or a health department to say, eat healthier, but that sometimes the environment where you live or your economic situation can be a real barrier to achieving that goal of eating better. If your neighborhood lacks a retail grocery store that carries sufficient produce, or you lack transportation to get to the nearest quality grocery store, the eat healthier advice just won't be enough. Recognizing this, about a year ago, ODH added a food systems coordinator to help identify these gaps and work with local health departments and other local organizations to improve access to healthy food. The last initiative I'll mention today is that I have tasked our staff at ODH with creating an obesity action plan. This project involves taking a look at what we're currently doing, what the evidence shows us is working, and what other states are doing. We then plan to create strategies that we hope will move the needle on that obesity prevalence number here in Ohio. As we heed the governor's call to work to help every Ohioan be able to lead their healthiest lives, we're prioritizing obesity as a public health issue. And now I'd like to turn to our guest for today, Dr. Barto Bergera, chairman of the Endocrinology and Metabolism Institute at the Cleveland Clinic. Welcome, Dr. Bergera.
Good morning, Dr. Wonderful. Thank you for inviting me. It's a pleasure.
Happy to have you. Dr. Bergera, as a recognized expert in the field of obesity, you understand very well how obesity impacts and influences so many other medical conditions. Can you summarize briefly for us some of the common serious medical consequences of having obesity?
Yes, let me first congratulate you and Governor DeWine for all the effort that you're doing to improve the health of the citizens of Ohio. The presentation that you have just given has been superb. You have reviewed the very important topics and what is behind obesity. Because obesity is the major health problem that we have in the US, but also in Europe. I am from Spain. I can tell you the prevalence in Europe of obesity is also increasing. So we are investing a lot of effort to take care of the consequences of suffering obesity. And for the first time, I hear a great review of everything that needs to be done, and more than that, that is what is being done to improve the health of our citizens. So the problem is that when you develop obesity, in general, other problems come up associated to that. You develop diabetes, you develop hypertension, you develop high cholesterol, osteoarthritis, sleep apnea, and it really is a progression on your weight and BMI with the development of these complications. In addition, your sense of well-being diminishes, your sexual function usually diminishes, your capacity to get pregnant is affected, and at the same time, you suffer discrimination. So unfortunately, everything goes together. So it is a major health issue that we need to take care of. In general, when you go to see your doctor or your healthcare provider, this individual put effort on taking care of the consequences that I have just mentioned. Some of them, very rarely, they address the primary problem that you described.
Thank you. Thank you very much for that excellent review. You know, Dr. Vergara, we also know, though, that people don't need to go to the extreme of becoming a triathlete in order to be able to make a difference when it comes to their health. What are some of the practical things that each and every one of us can do who might be worried about our weight or have diabetes or high blood pressure?
I think the first issue is that we need to put our health as a top of our priorities. In general, you know, we are very concerned about our family, about our jobs, about things around us, and very seldom we put our health as a top priority. So the first thing that we need to do is to see how is our general health. Most likely we have overweight or we have obesity. As you gave the numbers, you know, 35% of patients, of individuals suffers obesity. The prevalence of overweight is even around 60–70%. So we always try to improve 5 different areas when we try to help people to improve their general health and usually help them to lose weight. Number 1 is the nutrition component. You brought up the issue of the deserts areas for healthy food, and that's obviously a very important problem. But we need to improve our nutrition. Try to hopefully cut in empty calories. Make sure that we cut in industrial sweeteners, and try to really drink water. That I'm sure is what you're drinking, and making sure that we eat more plants, more vegetables, hopefully a very balanced diet. But we need to understand that everybody eats different. So even though the Mediterranean diet is the healthiest, not everybody likes to follow a Mediterranean diet. So you can follow other type of nutrition, but talking to an individual who has an expertise on nutrition should be, I think, a must. So improve the diet is number 1. Number 2 is physical activity. We need to increase our level of physical activity. And as you said, you don't have to be a marathon runner, but hopefully during the day, you find time to walk, and hopefully even more than that. You go to a more specialized place like a gym or the YMCA, where you can exercise hopefully 2–3 times per week. Maybe, that 30 minutes, you need to push a little bit your cardiovascular component. Number 3 is the appetite, the hunger. There is a limit of how much weight you can lose without the use of medications approved by the FDA for weight loss, okay? There is a lot of bias against medications, but we all have a set point, as you know very well. And in spite of eating 800,000 calories per year, we keep our weight fairly constant during our adult life, maybe gaining half a pound per year if we don't exercise. If we exercise, we usually keep that weight fairly constant. So our brain, the hypothalamus, has a very sophisticated system to regulate that weight. And that's why it's so difficult to sustain weight loss long term. Because as you start losing weight, your brain is trying to bring you back to keep that set point. Why is that happening? We don't know, and it's probably the most important research in the area of obesity. So we have that set point, and with weight, with improving diet and physical activity, you may lose 5%, but it's difficult to go beyond that just with changes in lifestyle. We will get back to medications in a second. Number 4 is sleep. You know very well when you are post-call, when you see patients, individuals who work 3rd shift, lack of sleep is a major health problem. Improves energy, improves sense of well-being, causes increased appetite, ghrelin and other hormones are responsible. So we need to sleep at least 7 hours, cut our screen time, and push effort to get a better night of sleep. And the last issue, number 5, is stress, anxiety, depression, the psychological component. Lives are very stressful. We are in a hurry to get things done. And when you are under stress, you eat more. Food sometimes is the way that we calm our stress. So I think I will invite everybody to identify what are your three stressors right now. My job, my significant mother, my kids, my home, and try to address those issues and do something about it. Maybe you need to change jobs. I sometimes I tell patients, maybe you need to consider switching jobs. Maybe you need to do something else regarding your family relationship. So those 5 areas that I just reviewed are very important, and they need to be addressed long-term. All of them long-term. And it's impossible to be successful long-term without touching in all of them, because the moment you stop doing what it has helped you to accomplish weight loss, you will regain the weight because of the set point.
Yes, yes, very helpful. Well, thank you so much, Dr. Bergera. As I wrap up today, I want to emphasize that we are not saying that as you sit down at the holiday table next week, that you should not eat the foods that you may look forward to all year. Instead, I hope you simply think about enjoying them in balance. Do you need a second piece of pumpkin pie? Or as you fill your plate, perhaps think about including plenty of green on the plate beside your turkey, and make your portion of starches a bit smaller and more reasonable. And perhaps on Thanksgiving, you could participate in one of the many turkey trots that take place all over the state with, of course, your healthcare provider's blessing. You don't have to be a runner. A lot of people participate in those trots by walking. It's good fun, gets you moving, which is proven to stimulate many positive health effects. All of these small changes add up over time. Perhaps they become habits and make a big difference in your long-term health and in your life. I wish you all a very happy and healthy Thanksgiving. And with that, Ken, I think we're able to move to taking some questions.
Okay, our first question today comes from Joe Ingalls, Ohio Public Radio and TV.
Doctor, thank you for doing this, but and I don't want to sound offensive when I say this, but you have said absolutely nothing new. Everything you have said has been something that has been preached for 2 decades. The fact is, though, that we know, looking at Ohio, we know there are a lot of people who are working very long hours, taking care of kids, driving too long, everything else, and they don't have time to get up and do the walking that you're saying. They might not have the health insurance to do the kind of care that you're talking about. You are addressing the food with the grants, but the thing is that this is a more complex issue, and to put it in, 5 bullet points, I think it's, what are you going to do to get to people or to make things better for people so that they can actually benefit from this rather than just saying this over and over? Sorry about that. I don't mean to be offensive.
No, Joe, it's a good question. And it certainly is true that this is not only a real problem, it's a multifactorial problem. And if it were an easy problem to solve, it would have been solved long ago. Clearly, we have to look at the issue of overweight and obesity in a comprehensive manner. And I hope that what you're hearing is that that's exactly what we are working to do. And it certainly begins with the kind of engagement that we have had over the last few years with communities and understanding their challenges and situations and working together to create environments that make it much easier and much more attainable for people to make good, healthy food decisions, as well as incorporate exercise and activity into their everyday lives. Some of the communities that we've seen around the globe that enjoy some of the best health and the lowest rates of obesity and overweight are communities in which it's relatively not only easy, but a part of that busy, challenging everyday work life to walk and exercise, in some cases, ride bicycles, et cetera. And so this approach that we're taking and advocating for is, in fact, a comprehensive approach, but we have a lot of headwinds that I think you've rightly identified that we're dealing with. But we're trying to address those and working on conversations across agencies, with communities, with workplaces about the changes that together we can make that focus on this very simple message that is still a medically accurate message, that we have to take the steps needed to make it more a part of our everyday lives, to eat differently and to exercise more. Dr. Bergara, you have, of course, a tremendous background in this area. Anything that you would add?
Yeah, I think something really has changed. And the main issue right now is that you can have a conversation with your doctor regarding obesity that before, a few years ago, you could not have. So more and more physicians and providers feel that obesity needs to be treated. Okay, and that didn't happen before. When you go to see your doctor, they usually tell you need to eat less and exercise more. And I agree with what she just said, that nothing has changed regarding that. That's not the answer. Right now, we have tools that can help people to sustain long-term weight loss, okay? And that's new. I understand, and as I said, life is complicated, and when you're very busy, your health is not a priority, but you need to make that effort. I'm sorry, but you need to make that effort that unless you take care of yourself, it's going to be difficult for you to take care of your children. And you need to think how many hours you spend watching TV, okay? Maybe that's an area that we need to cut. How many hours, how can you find support from friends, colleagues, family, from our state? You need to seek for help. And life is complicated, I understand that. But the main difference right now is that we have tools that before we didn't have, and the physicians and the healthcare providers are getting very familiar on how to treat obesity, but before we did not.
Okay, our next question comes from Todd Dykes, WLWT TV.
Hi, everyone. Dr. Vanderhoff, this is for you. Can you all hear me?
Yes, we can.
Okay, great. It's been the Zoom thing after COVID. Now I'm back at it. So my focus today is reporting on RSV and whooping cough cases or pertussis. Warren County's health department's reporting that they've had 15 whooping cough cases so far this year, 14 in the last month versus 1 all of last year. So I'm just wondering, that makes me as a parent wonder, is there any indication that, and I don't know the age ranges, they didn't break that down, et cetera, HIPAA and so forth, but are we worried that fewer people are getting vaccinated at a young age against, in particular, pertussis? Or what data? I don't know what data you have access to. And I'm thinking about the vaccination side on that front. And then just a couple general thoughts about how contagious these respiratory illnesses are.
Well, thanks for that question, Todd. I think that what you're sharing, it really illustrates just how essential our vaccinations really are. We really cannot think about these conditions, these diseases, as things of the past. Whether we're talking about RSV, for which vaccination is much newer, or we're talking about pertussis, a vaccine that has been around for a long time, or any of the longer list of vaccine preventable illnesses, diseases like measles, mumps, tetanus, many others. The vaccines are our best and most essential tool of prevention. And it is far better for us to protect our children from getting these than to deal with the aftermath, which can include, unfortunately, hospitalizations and death. Now, as we look at vaccination rates in Ohio, we were pleased to see our statewide kindergarten vaccination rates increased in the 2022-2023 school year, the previous year, after 2 years of decline. But those rates, while they improved after a couple of years of decline, are still not back to our 2019-2020 levels. So the year, really before we were deep into the pandemic. But we are at least encouraged that we saw that increase last year. Now, our rates of exemptions did rise in the past school year, which also reflects a national trend. And exemptions for medical reasons or for reasons of conscience or religion are in fact in the Ohio Revised Code. So at the end of the day, we certainly understand and respect the need for parents to be making the decisions about their child's health care, including vaccination. But we really believe the facts point very strongly to the wisdom of getting your child vaccinated against these very preventable conditions.
Thank you.
Our final question today is from Aaliyah Seabrooks, WDTN TV.
Good morning.
Good morning. How are you today, doctor?
Good.
Good. I just have one question for you. Can you talk a little bit more about the produce prescription and more about the financial backing behind that initiative?
Yeah, we can get you more detail on this following the press conference. But at a high level, what I can tell you is that these were pilot programs that come to us that we're able to offer largely as a result of grant opportunities that the state of Ohio was able to secure. But we're looking to expand those opportunities and to work with more and more communities to help them with some of the challenging issues that are our first question pointed to. We understand that it can be hard to get at healthy food. And these pilot programs that we've had across state appear to be successful and really seem to be a part of the complex answer to the challenge that Joe Engels pointed us toward at the beginning of the conference.
Okay, we want to thank our guest today. And Dr. Vanderhoff, do you have any closing remarks?
Well, I just want to thank all of you again for your very thoughtful questions and for your engagement around these important health issues that we talk about on these press conferences. And I, of course, want to wish you and all Ohioans a very healthy and very happy Thanksgiving holiday next week.
All right, that will conclude today's press conference. And
All right, so there you go. That's an update from the Ohio Department of Health. We heard from two doctors there. First, Dr. Bruce Vanderhoff with the Ohio Department of Health, and also Dr. Barto Bergera from the Cleveland Clinic. He's the chair of the Endocrinology and Metabolism Institute. Let's start with one of the two issues that they spoke about, obesity being one of those issues, and the numbers are not great here in Ohio. Unfortunately, Ohio's 7th in the nation in adult obesity rate, which puts people at a great risk for chronic disease and mental health.
19 News is everywhere. Download our CTV apps and follow us on social media @Cleveland 19 News.